October 24th, Social Services Committee meeting. I would like to thank everyone for being here with us this evening. We're going to jump right into this agenda. We have a lot of things to cover this evening. The time is now 7:40. And the roll call. Carol, are you doing the roll call, or is there a roll call to call?
You can do a roll call.
Who do you want me to call? Just the people here, or?
No, just the ones here.
Okay, so
Them on my list as they come in.
Okay. So a couple things. So I'll just do a roll call. Donna Rose,
Present.
Sharon Marshall,
Present.
Monica McCain Brown,
Present.
Tessa Wilson,
Present.
Janice Reed,
I'm present.
Zenovi. Is that Zenovia or that's what's your first name? No. Sharon, what's the your colleague? It's Zulma.
Yeah, Zuma
Novoa?
Novoa. Yes, Novoa. Yes.
Okay. And you're present. And Sabine, what's your last? Sabine Jacques?
Thank you. Good evening. Sabin Jacques present.
Okay, great. And Rhonda Joseph is present. Did everyone have a chance to review the minutes that was sent via email?
You don't have a quorum, Miss Joseph.
So I can move on the agenda.
Yes.
How many more do we need for quorum if I have to revisit the minutes?
You need 14 people. You have 26 on your list.
All righty. No problem. So if we get the 14, we'll revisit the minutes. Okay? That works, Carol?
Yes.
All righty. And good evening. I have someone that just stepped in, a D. Gay.
Hi, Diana Gay, committee member.
Hi, how are you?
I'm well, and yourself?
Oh, I'm great. Thank you very much.
Okay.
So just to bring us up to speed with a couple of things on the agenda, my to report. In September, issue was raised to the chair and also to the CB17 treasurer for the significance of having Social Security Administration maybe make a presentation either at this meeting or in some forum to give some information to the community. And there was some debate back and forth, and I did tell the chair and our CB17 treasurer that we would, or I would bring it up at this meeting to see how we would like to handle it. And if we felt that Social Security Administration was something that we felt we needed to have as a presentation. So I didn't bring it up last month, so I'm bringing it up this month just to get from our attendees here how you feel about a presentation like that, and if that is something that we should put some time into bringing them here to present. So the floor is open for discussion. If anyone has an opinion, I have none either way. I'm fine if they do come here. I'm also fine if maybe they were to table at a resource fair. If we do have a presentation for the community, I would hope then that we would have an audience for such a presentation. So are there any thoughts on how we would want to handle that? Do we want to bring them in or not?
Because in here, stations is the only thing that matters. It has to be 12%. less than $1 a day. There's no safe. Like said,
Is that a yes or a no? Bring them in, don't bring them in? Do we want to table this conversation and give people time to think about it?
Protection from weapons.
Or do we not feel that Social Security Administration information is what's needed at this time?
Seat protectors defend against dirty clothes. Cargo provides.
Can we mute if we're not speaking?
Make sure your phone is secure.
Josephine, will this be for the
Thank you.
committee only, or would it be for the entire board? Is that what the request has been?
Well, at the time that it was raised, I think, by an executive board member to the executive board, that they felt Social Security Administration was something that we needed to bring in to have them do a presentation. So Social Services Committee can have them do the presentation in one of our meetings or something separate, or have them as a resource later on down the line. So there wasn't really a distinction of how to do it, just that this committee should be the one, whatever we roll out should be the one rolling it out.
I know just of the history is that, we do present these things and then other members from the board do not attend,
Right.
specifically tend to our meeting. So is it going
Right.
to be just, something just tailored to the few of us? I mean, we've had them come in, had presentations of Social Security issues before,
Mm-hmm.
built into long-term care, et cetera. So, I mean, I don't, I don't know if it's a pressing issue for persons right now, but I mean, it is something that, that every,
Mhm.
anyone over 65, that information, can be
It's
geared
crucial.
to.
Yep.
But our committee members, well, maybe you did say now we do have 26 members, but how many of the 26 members are actually here now? So if we do have it, and they're going to attend to listen to this, so is this something that we should,
Right.
that we can probably tailor maybe later? The year just started, so maybe we can do it in the spring, something a little later. So just my thought.
Yep. I'm in total agreement either way, but I did have to bring it up because it was brought up. So I did have to bring it to the floor so that people had a chance to chime in on the direction. And yes, I do appreciate the fact that, yeah, it can't just be us also. We have to, bring in people to hear this information, unless we're turnkeying this information out and the community's getting it. So that's also my fear if it's just us and we're not disseminating. So it's on the floor. I'm gonna leave it there. It's something to think about, so we can think about it, but just know that if we're gonna bring them in, it does take time. We have to make schedules and appointments and their availability, our availability, so it can't be just done tomorrow. If this is something that we decide later on that we wanna do, it will take a little bit of time. So I did my part, I've raised it, so I can do a check there. And I also would like to say, with regard to the resource fair, I believe we are going to have a subcommittee and start pooling in the other committees who are interested in participating in this resource fair, so that they too can start chiming in and bringing in the resources that they would like at the fair. And if we're looking to do this fair, maybe April or May, we will have to start planning now. And we also would not be able to do that in this meeting. I just don't see how all of that lifting is going to happen here. So if there are people who are interested in being a part of that planning for the fair, you could put your email in the chat and we'll grab it from there. And as I start to reach out to the other committees and we start forming this team or group to roll out and put together the fair, then that's how we're going to do that. Is that good with everyone?
Sounds good.
All right.
Sounds good.
Okay, thank you. So we're going to move right along. We had the opportunity, I know we spoke very heavily about health issues and disparities at our last meeting. So Ms. Sharon Marshall from the Department of Health has agreed, and I'm so appreciative because I just did this like at the last minute, to come in and to discuss some of the data that the Department of Health has been pulling in and disseminating that information to us so that we can understand and get some insight as to what's happening in our community. From our, is this our city's doctor? Is that what he says, Sharon?
Yes, I guess he says that. You know, I think they're trying to land on how to best
Right, to
convey
say that.
who the Department of Health is. Yes.
So I want to welcome you and Zelma, and I'm giving you the floor. Thank you so much.
Okay, and I have the opportunity to share screens, right? Okay. I'll give it a try, okay?
I think you can. Carol, she can share screen. Does she need you to share the screen?
No, she can share it.
Okay, great. Thank you.
Perfect. Okay, because I got it right here. Okay. So thank you for providing this opportunity. I have my colleague with me, Ms. Zulma Novoa, one of our community health specialists. I'm the
Evening.
director of I'm the director of community engagement and partnerships for the Bureau of Brooklyn Neighborhood Health, part of the New York City Department of Health and Mental Hygiene. We're our assistant commissioner, Dr. Zahira McNatt, oversees much of the work we do within Central Brooklyn. I believe that Dr. McNatt have opportunity to introduce herself last year or last fiscal year to Community Board 17. I believe there was a road show at one point, but if she has not had the opportunity to do so, she would be more than gracious enough to introduce herself and share some high-level information about our direction out of the Brooklyn office. Okay, so the Bureau of Brooklyn Neighborhood Health, I'm just going to go through this quickly so you kind of have an understanding of the work we do and how we fit into the larger Department of Health picture. We are part of the Center for Health Equity and Community Wellness, where Dr. Michelle Morse is our deputy commissioner. So the Bureaus of Brooklyn Neighborhood Health, it strives to reduce health inequities in North and Central Brooklyn. Residents have been unfortunately impacted by discrimination and long-term disinvestment in Central Brooklyn. Okay, we use evidence-based interventions, community experience, and data to inform equitable programs and strategies to improve health and well-being. Okay. We use a collective action approach, and we focus on addressing the primary drivers of premature mortality. And so just going over some of the ways in which we develop strategies to foster improved health outcomes, data and storytelling, influencing policy change, implementing place-based programs, and bringing investments into the area. And investments are by which of grants and things like that to help to expand our footprint. You know, much of the work done by the health department is through city tax levy dollars, but grants also help us to do more innovative type of work without using the city dollars. So resources for health data. And so we're presenting here because we know that each year you develop your district needs statement. And so to help you develop an informed district need statement, we are more than happy to share the data that we have or even point you in the direction of some of the data. So I have hyperlinks here, and I can forward this to Ms. Joseph as well. That'll help you. And so some of the things that you will find on the data page, so the top line is the overall data page. Then you're going to see some recent reports, one on mental health in New York City, another one on the changing birth composition in New York City, and the urban heat island effect in New York City that I had shared with Ms. Joseph. And then, of course, the community health profiles. And I like how the community health profiles are organized as well, because they also help us as far as understanding the structural determinants of health. So in your fiscal year 23 statement, these are some of the things that you said that the neighborhood needed. To create or promote programs that destigmatize mental health and encourage treatment. You needed other programs to address public health issues, requests and funding for mammogram testing. Also to create or promote programs for education and awareness on preventing chronic disease, including smoking cessation, nutrition, physical activity, and then animal and pest control requests, including reducing rat and mosquito populations. So that was in the last district need statement. And so someone typically at your district cabinet meeting would serve as a representative of the health department and then address some of the things that fall under the bucket of the Department of Health and what progress that we're making. One of the things that we're always talking about is pest control. There's not one more because I attend Community Board 3 and Zulma, the community boards you attend are.
Oh, that's Community Board 4, and good evening.
Yeah.
I will be piggyback in a second, ma'am.
Yes, okay. So next slide. So,
Okay.
so if you want to discuss the
Yeah.
community health profiles, yeah.
Yes. Yes,
Mhm.
ma'am. Good evening, everyone. And I do apologize. I had a little technicality with the connection. That's why I was not able to introduce myself correctly. And as Ms. Sharon said, I am one of the community engagement members of her team. My name is Zulma Navoa, and it's an honor to be presenting tonight along with my wonderful director, Ms. Sharon, a great teacher in many aspects. As you can see in the PowerPoint with the community health profile, and Ms. Sharon, who has access to it, would just click to the next slide if it's possible, ma'am. As you can see, we've been through a lot lately, especially with COVID. This usually takes approximately 2 years to put together. The last one that was done as of now was 2018, even though we're trying to compromise some with 2019, especially with COVID. I like to tell everyone always data is always a little bit 2 years behind. And we may expect this data to be a little behind due to COVID that took us a big impact. But as you can see right now, where we are, who we are in the life expectancy, this was back in 2018. Now, you got to keep in mind this data is 2016, 2017 combined to give us 2018. A lot has changed from this. And once we go back into the community, gather this information, you're going to see perhaps these numbers either better or worse. We don't know, but we just want to be positive. But we really want to do is get a true capture in the community and the needs themselves, as Ms. Sharon has pointed earlier. Next slide, please, ma'am. In this slide, as you can see, and I'm just doing it from my computer as well, the neighborhood where the community is per se. I'm not sure if you can see it very clearly where that was circled, but also the leading cause of death. This is also going to probably have changed once we can gather information. But again, our goal is to focus on those needs, especially the ones that Ms. Sharon mentioned earlier, preventing chronic diseases, including the smoking, nutrition, physical activities. We're looking at hypertension, everything. we want to sort of capture that, where all of that is now as we speak. Next slide, ma'am. Here is the leading cause of death. Again, not to be morbid, I know this is going to change as well. COVID-19 took a big impact across, of course, the whole nation and the whole world. And we want to get back to where we were, in a way, in a positive attitude, capture true numbers.
Thank you so much.
Oh, I'm sorry. I lost someone. We definitely want to capture true numbers and what the community has gone through, and also with the children and adults and our seniors as well. Um,
Yeah,
again,
so
yes,
if you
ma'am.
can't see it clearly, for non-Hispanic Black, the leading cause of death is heart disease, then cancer, then diabetes, then other cardiovascular diseases as well. Those are the top leading causes of death.
Yes, thank you so much. Yes, because I'm trying to zoom in as well as mine
Yes.
at
Yep.
this end. That's what we've really been facing, and we can see how it hits in many of our African American community, our Latinos,
And the
Latinas,
Latinos
and everywhere within our own community.
yeah.
Um,
And then
yes, ma'am, go
yeah.
right ahead.
No, and Hispanic, in the Hispanic community, we see heart disease, cancer, again, psychoactive sedatives, unfortunately,
Yes.
cardiovascular disease. I want to point out that we separate Puerto Rican in the data when it comes to Hispanic rates. And there's lots of different theories or reasonings why we do that. But when you pull it all together, you kind of lose the uniqueness of the Puerto Rican experience. Somebody said the theory is that the Puerto Rican population has had the most exposure to American culture. And so some of the unfortunate health outcomes are worse. There's less protective factors than maybe recent immigrants from Ecuador, Colombia, etc.
Absolutely. A true good point, Ms. Sharon. That is so true. So unfortunately, the diets and everything, they have adapted to it. It has not been the best, but that's across the board with so many. And my fear may be with the new members that are coming now. Their diet's a bit different, but who knows what may happen within a year or two, when we also may start seeing their outcome when it comes to these diseases as well, sort of increasing. Thank you for pointing that out, ma'am. And now this is also the next line, ma'am.
Okay.
Here we are with the prenatal health. Again, another important factor about pregnancy outcomes in the community. Again, this data again is 2018. We are definitely hopefully see how these numbers can be either positive or negative, as we have seen, and in the community, as you can see the darkness in the map itself, how it has affected us. The good thing is also in the Bedford office, in the Brownsville office, we do have wonderful programs for our moms and everything that can really participate in many ways, especially with their pregnancy, with the doulas that we have, and even newborn care classes for our moms in the community, which I think is so important. We hopefully could see some positive outcome when it comes to the pregnancies in many aspects. Anything you may want to add to that, Ms. Sharon? Or
Yeah, and so I also wanted to point out as far as pregnancy outcomes, and you could see where we kind of land, and this is around teen pregnancy. Now, teen pregnancy has gone down significantly. And as I talked with some of my friends as well, back when I was in high school, lots of young ladies were pregnant at the time, got pregnant during high school. So it has gone down significantly in our communities, but East Flatbush still has in comparison to other parts of Brooklyn, still is in the top third of teenage pregnancies.
Thank you, ma'am. Again, the next slide will sort of piggyback with what you were saying.
Mhm.
And this is where we see the infant mortality. Again, the community of East Flatbush, how it has been impacted. As you can see in the circle, and I apologize because my computer doesn't give me the sharpness, but I can see how it's been circled there as well, as we can see. And again, in Brooklyn, where we are at the bottom when it comes to the severe maternal mobility,
Morbidity.
unfortunately,
Yes.
in Brooklyn.
Yeah,
Mhm.
and I could expound further on this. So, if you're unaware, and I'm sure many have learned that infant mortality really is the gauge by which you determine the health of a nation or a community. If you have a high infant mortality rate, that means that there may be other things within the system. That goes beyond health and healthcare access that impacts that. So infant mortality are infants that die before they reach the age of 1. Okay, so within the borough of Brooklyn, as we see again, the East Flatbush is in the top third of communities with infant mortality rates that are high. We also see here, the 3-year average of infant mortality was highest in Queens Village, then followed by East Tremont and South Bronx, East New York, Brownsville, and in Williamsbridge. But East Flatbush is there. And severe maternal morbidity is it's the illness, the other poor health outcomes related to pregnancy and birth. And so, unfortunately, and this was prior to COVID, East Flatbush had one of the highest severe maternal morbidity rates in the city, not just in the borough. So, so there are a lot of efforts within the Department of Health to address that. I know that they work with Dr. Michelle Morse, our Chief Medical Officer of the Health Department, and chair of a birth equity initiative that involves insurance and hospitals and things like that to work on that. And they do partner with Kings County and Downstate as well to address this crisis within the East Flatbush community. COVID, we believe, although we're still working on the data, may have even made things worse. And so, and we know during that time, even with giving birth, pregnant people would go into labor and go to the hospital and could not have any support.
That is so true.
We started having the doulas started doing some virtual support. And so one of the factors that impacts maternal morbidity and mortality is also mental health. And so, so yes, we may know of hemorrhages and things like that, and embolism, but mental health crises as well can be a component, because you don't just measure these things based on just the actual childbirth experience. It's the continuum of the pregnancy to postpartum as well.
Thank you for that, Ms. Sharon. That's a
Okay.
worth of knowledge I've learned from you
Yes.
every day, and I hope, awesome. Thank you so much, ma'am.
No problem. No
And
problem.
the last two slides that we have had to do actually with the impact of the climate. This is during the summer season, even though now we're in the fall and entering the winter. I think it's something of value that we need to keep in mind. Basically, what are the neighborhoods that are very vulnerable to heat, and East Flatbush happens to be one of them. And as you see in the heat vulnerability index, it's where it's in the map, it's like a 5 at the highest risk. And these are really, really important for us to also understand, even though, again, we're going into the fall weather, but before you know, we go back to the spring. And unfortunately, the fact that many of those in these low income neighborhood or
Mhm.
non-Latinos and
Mhm.
African American brothers, sisters may not have access to ACs, may not have access to the other luxuries that other communities may have, or even cooling centers, and they may have to travel further, still puts them at high risk. And any other underlying illnesses that they may have, of course, would be accelerated due to the heat. And again, COVID was a very big, heavy impact. We just came from a very hot summer this previous year as well. And as we move forward, we don't know, but hopefully, as we start in changing with the climates, we will be able to get more information, more education out there of what we need to do. And if you go to the last slide, Ms. Sharon,
Mhm.
it, or yes, that really shows the ratio. As you can see, just the whole entire impact, how it affected the community in so many ways. And what's important further down, where it says the racial disparity in heat vulnerability, the impact is just extraordinary, how it hit so many within our community, our brothers and sisters, African Americans, the Hispanic community, and white, non-Hispanic. But you can see how high is the rate when it comes to the African American community. Again, another important factor to keep in mind, that if you are in these communities where the heat stress is so high, the death rate it's just incredible. As we can see, the whole goal is how to bring better understanding of how heat stress works, how to bring other resources to the community, and how we as a community and Department of Health can help in
Mhm.
many ways, even having lower access to AC for our community, building better green spaces, neighborhood cooling center, and resources that are within the community. And our community folks don't need to go beyond the community to get those resources. Again, I know has to do with the summer, but I think it was something very important to point out. As you can see the chart below, how high it hit. And this is an average annual between 2010 and 2019, the
Mhm.
death per million. So it's a pretty high number, but I think as we get more educated, we could definitely bring these numbers down in many ways. Again, we don't know what COVID did. We will probably find out soon. But as we move forward, we will probably have more updated data. And I just want to leave also in this chat that this week is called the National Lead Poisoning Week for our youngsters. So from October 24th to the 28th is the Safe from Lead Poisoning. And that has to do with all our children, especially in NYCHA, in any environment where many homes who know that may still have some lead paint will be very quite surprised. But this week is our National Lead Poisoning Week prevention, and hopefully I may be able to send this flyer out ASAP as of tomorrow, Ms. Sharon, and to the
Yes.
community there at CB17. And I'll give it back to you, the floor, ma'am.
Okay, thank you so
Thank you.
much, Zulma. And
You're welcome.
I had shared with Ms. Joseph about the heat islands. So funny story. Well, you know that I live in the district. And so on my block, 3 trees were planted, and I was excited, and my neighbor was groaning about it. And I said, "Don't you understand that, this district is considered a heat island?" And so these are some of the strategies that we use to cool down the neighborhood and help protect the health and well-being of the residents. And also more trees help to have cleaner air and reduce asthma, because we do have high asthma rates in East Flatbush. So of course, I was more excited than my neighbor. She was just thinking about the leaves that she would have to sweep up in the fall. But so having extra foliage in the neighborhood is very important to reducing heat, and you can make requests to have additional trees. The work isn't done yet because that was only in the front. I live on East 96th Street, so I'm in the Remsen Village area where we have like one tree that's kind of holding on, you know? So you need far more coverage as far as trees go to have a cooling effect on houses. So I felt it was important to share this information. Does anyone have any questions? Because we do have the community health profile, but yeah, I didn't want to take up all the time. I thought that this was like a taste of some of the data and information that you might want. Yeah. I'll stop sharing. Any
I like the
questions?
chat. Someone said we need to take care of the trees.
Yes.
Yes. Yes, we do.
I did have a question. This is Tessa Wilson. I noticed
Yes.
that the list of regarding mortality, it was
Yes.
heart disease and then cancer. Is there any specificity as to which kind of cancers?
I could drill down deeper as far as which cancers. Typically it's lung disease first. But we also know, especially since October is breast cancer awareness month, that we do a lot of work around that. But as the statistics show, we get diagnosed at about the same or less than white women, but are more likely to die. That's much as access to treatment, treatment that is culturally, humble and culturally accessible as well. So this is where disparities is where the intersection of disparities and inequities fits in, because if you're diagnosed less but die more, it's more than just unhealthy lifestyles.
Amelie Mickle,
Yes.
do you have any data to show how the people in the community take their vaccines? How well do they take the vaccines that are available? Would you know?
Oh, yeah. So which vaccines? The COVID vaccines or?
The COVID, the flu, all the other
Mhm.
vaccines that we're supposed to take.
Yeah,
Yeah.
so I did have a look at the recent data for East Flatbush. So 80% of East Flatbush has at least had one dose,
Okay,
okay,
one dose.
of the COVID vaccine. However, only 33% have had the booster.
Wow.
And so perhaps some further education on the value of the booster, knowing that we have aging population within East
Mm-hmm.
Flatbush. So it's recommended that individuals 50 years and above consider taking the booster. And now that we have the bivalent, as Zuma jokes, I call it the cocktail because it's a mixture.
Yes, ma'am. It's the
Call
cocktail.
it the booster cocktail. Um, have a campaign to encourage vaccinations. I know with some of our work, and our team is small but mighty. We're mobilizing around in Crown Heights by Weeksville, who had real access issues, and we're doing some campaigning there around increasing booster rates. But we can figure out how to promote the existing places where you can get boosters. And believe it or not, I have checked some of the pharmacies within East Flatbush, and they do have the bivalent booster. I just think that the promotion isn't the way, and this is just me, walking up and down the street or driving past isn't as intentional and intensive as it was with the initial vaccine.
Vaccine. That's true.
Yeah.
That's true.
And just to piggyback on that, ma'am, and I'll let you go as well. We have recently seen a surge, and this is critical for the community on what we call RSV. Those are the virus that's affecting a lot of our children. So we're seeing a combination now, unfortunately, due to, of course, COVID, and now we're entering the flu season, and now you also have this RSV, which is a respiratory virus that is usually spread among children. Is very high. So we're seeing that it's not that it's out of control because the city has acted very, really quickly to this, and we're not yet overwhelmed, which is a blessing, and I hope we don't become overwhelmed. But right now we're seeing is a respiratory illness that has spiked among children, so this is very important, but not only among children but also on seniors or those with their immune system compromised. So something to just look out. So now we have like these three things that are happening. We do have the COVID leftovers, like I call it, because it has sort of mutated. We have now the flu season that has now kicked into gear, and now we have the what is called the RSV, which is that respiratory virus that is affecting a lot of our youngsters and children. And you're probably going to start hearing a bit about this in the news. But as long as we get vaccinated, and of course that's an individual choice, just to reduce this, or maybe just if you know you're sick, wear a mask, stay home, do the best you can, because we're still going through that little hump, and we may be seeing other things just merging up because we're still in that season. Unfortunately, we're going into the third year right now with COVID. So hopefully we'll overcome this. Not to be giving anyone any bad news, but just to keep in mind that we're seeing this as well right now. This is a small surge that's happening of another virus. I'll just mute myself on that.
That's okay. And we're ramping up distribution of test kits again for as the cold weather happens. Sabine, I think I see.
Yes.
Okay.
Good evening. Thank you for the presentation. I did have a question, and I had actually put in the chat. So I don't know, as you're collecting future data, will you take into consideration if there's a correlation with increased smoke shops in the communities? I don't want to make any assumption, but this data, was there any, at that point when you're collecting your data, I don't want to make any assumptions, was there any smoke shop consideration? Because I've seen a trend of increase in smoke shop in certain communities. So how would that be taken into consideration? Because there must be correlations. So please speak into that. Thank you.
Yeah, so the initial community health profiles, let me see if I had low smoking rates, believe it or not, in East Flatbush. But remember, this data was pulled prior to all these laws being passed related to, marijuana industry and all of that. I'm checking to see if I can pull it up for you. Okay, no, apparently it won't let me pull it up that way. Yeah, so I'm gonna stop sharing because I was trying to get to, oh, okay. Let me see, I might actually be able to get there. So East Flatbush had low smoking rates, but yes, you see a lot of smoke shops in the neighborhood. Of course, as a resident, I say this isn't what we asked for, but okay, so yeah, so that's where we are. So physical activity, diet, and smoking, 73% of East Flatbush adults report getting physical activity in the past 30 days. Let me go down here. Okay, current smokers. So this is where we were. Okay, so the adult smoking rate in East Flatbush is lower than the rest of the borough, but I'm sure, and I can ask whether or not we are going to be studying the impact of the proliferation of smoke shops in the neighborhood.
Thank you. Thank you very much for that.
Okay, you're welcome. Any other questions? Is there a section that you want to look at? You know,
And there's another good thing about the smoke shop, ma'am, as you mentioned earlier too, with the vapor.
mhm.
That's another issue that you'll probably find under community health that we've also been a true strong advocate against, because that started affecting more of our younger people. So that's another issue that we also have addressed within the Department of Health, trying to get the young people away from that, because prior to 2019, and I say 2019 because of COVID, we saw a big increase, but there was a big advocacy group and also with DOH that we got behind to try to reduce that, because it was targeting many of our youngsters within our community. And unfortunately, that it was just very easy to get to, but there's been laws in place for that. But again, that's also you're still smoking secondhand. You just don't want that.
Any other questions?
I see CK's question, but I'm not quite sure. CK, if you could elaborate what you mean by cold?
Someone mentioned something about a cold.
I'm
Oh, what
sorry.
about cold? Oh, okay. You
Right,
mentioned
it's in the
heat
chat.
islands. What about cold? Okay. So I didn't see a report. There's no report about that, but we do know that uh we do know that if you don't have access to things that'll help cool you, you might also be living in buildings where heating may be a challenge as well. So I can ask if there's any recent reports around how the cold impacts. Of course we know the cold impacts us, but if you look at the relationship between not having access to those resources for cooling, it's likely that you're not going to be living in places that where the temperature is regulated properly to begin with, whether it's due to the landlords and things like that, old buildings, stuff like that.
Well, Sharon, I want to
Yes.
say thank you, thank you, thank you. This is truly some rich information, and it is a lot to digest. So we will be able to send out those links, like you said. You'll send them to me, and I will
Yes.
definitely send them out to everyone, as well as the community health profile. Did I get it right?
Yes.
Right,
Yes.
so that people can dive in and extract some information. And if you guys have further questions after tonight, we definitely could raise them and see if we can, get down to some nitty gritty, some answers and some solutions. So thank you again, and thank you, Zoma. I really appreciate it.
Thank you, ma'am. It's been an honor. Thank you so much.
Oh, thank you.
Okay. So
Alrighty. Oh,
we're
sorry.
gonna
Go ahead, Sharon.
depart. I unfortunately I can't stay on longer today, but usually I stay till the end. But I'll have to leave you, but thank you for giving me the opportunity to present.
Thank you. Good
Thank you.
night, ma'am. Thank
Of
you.
course. Thank you. Have a good
Thank you.
night.
Good night. Bye bye.
Alrighty. Miss Biena May is not going to be able to be here this evening, and she is next on our agenda. So I will give the floor to Ms. Wilson, who has some information that she'd like to share that may be of use to either you or your constituents. Ms. Wilson, you have the floor.
Thank you so very much, Ms. Joseph. I really appreciate the opportunity to present, but I'm very grateful for the information that was shared with us as a community so that we're mindful of some of the health disparities that we see in our community. But I'm here to talk about a very different thing. It's an upcoming community event that's being held in Community Board 1, However, it is a community event that will benefit North Brooklyn as well as Central Brooklyn. The United Federation of Teachers, along with the American Federation of Teachers, we're putting together a book giveaway and resource fair. So we're giving away 40,000 books on Saturday, November 5th at PS 257, located not too far from Woodhull Hospital in the Williamsburg Bushwick area of Brooklyn. And we're asking for people to come out to help build libraries and to foster literacy in children. And families will be able to receive up to 50 books per family. So we're asking everyone to come out. It's going to be a festive, fun day and get free books. And we're also seeking volunteers. So Miss Joseph has all of this information, and I'm sure she would. I'm just going to, ask, and impose on her for her to share this information with you if she hasn't as of yet. We're asking for volunteers to help us on Friday, November 4th, the day before, because it is a massive undertaking to unpack and prepare for distribution of 40,000 books. But they are free. We ask that you register, come out and have a great time, and partake of a wonderful community event where school kids K through 12 will be able to get free books. So thank you so very much for this opportunity. Are there any questions at this time? I see that someone wants to give me books. I
I
would
suppose,
yes.
I guess the schools know about this, right?
I've
With,
been sharing the information with the immediate vicinity.
okay.
But
Okay.
I happily say, I will share my email, twilson@uft.org. That's twilson at U like umbrella, F like federation, T like teachers.org. If you'd be kind enough to email, I will gladly respond with and answer any questions that you may have. Thank you.
I'll definitely send out the information, and I'll send out the flyer. If anyone is interested, I will send it out.
Thank you. I really appreciate it. And again, thank you
Mm.
so very much for giving me this opportunity.
You're welcome. Thank you. Have a good evening.
Thank you.
Okay, next on our agenda, is there any new business? Any unfinished business? And are there any questions, or is there anything that anyone would like to raise before we adjourn for the evening? Tonight, one of the things I did want to raise was changing this meeting time from 7:30 to make it a little earlier, if that worked better for people. Since we don't have quorum, I'm putting it on the floor just as a discussion piece. However, we can't vote to change the time for this meeting. So we will be meeting again in November at 7:30, but that was a question that was asked of me by a few people who attended last month, if we could change this time to make it earlier. So hopefully next month we'll be able to do that. I'm sorry, say that again?
Monica McCain Brown, what time are you thinking when you say earlier? What's the time frame that you're looking at?
6:30.
Oh, no.
That's kind of, okay. That's difficult.
That's kind of, well, right, we're discussing it. It's just something I'm
Right.
raising. The
Yes.
7,
No, I just wanted to get an idea of what you were thinking of, what the time frame would look like.
Oh, okay. Yeah, 6:30, 7. If it has to be 7:30, then it will stay 7:30, if that's what works for, everyone. But again, it's nothing we're voting on because we don't have quorum. So it was just for discussion. So if there's nothing else, it's 8:34. I'm going to adjourn the meeting. Can I get a motion to adjourn?
Motion to adjourn.
Who's making the motion?
Rose.
Thank you, Ms. Rose. Can I get a second?
Ameline Mickle.
Thank you, Ms. Mickles. Everyone have a good night. Thank you for coming, and please stay safe, and I will see you next month. Happy holidays, I guess. Yep, we'll be
Thank you.
after Thanksgiving.
Thank you. Okay.
All righty. Have a good
Thank
one.
you. Thank you, everyone.
Good night. Thanks,
Good night.
Carol.
You're
Good night.
welcome.
Good night, Carol. Have a good night. Yes.
Good night.
Good night. Thank you. Bye-bye.
Put up a call for the meeting.